Okay, thank you very much. First, I'd like to thank everyone for attending, and I'd also like to thank those members who have submitted questions for us tonight. Uh, we would request that all the attendees stay muted during the OI Town Hall. The Town Hall is being recorded and it will be posted to the OI website elections page. My co-moderator is Catherine Walton Elliott from the endorsement team, and she will be monitoring the chat for questions. You are all invited to submit questions during the town hall, and we'll do our best to address those. I'd like to turn the program over to Catherine so you can get to know her, and I'll ask her to state our native land acknowledgement at this time.
Thank you, Ed. We would like to acknowledge the Indigenous people who have stewarded this land since time immemorial and who still inhabit the area today. The Stachas Band of Indigenous people of the Squaxin Island tribe. We recognize that this acknowledgement is only a first step as we work toward reconciliation. Thank you.
This evening's first segment is with Representative Jessica Bateman, who is running for the LD22 senatorial seat. Catherine will be leading the evening's second half with Lisa Parsley, who is running for the LD22 legislative seat. I'd like to mention that in about a week, on May 29th, we'll be hosting another LD22 legislative candidate, Sid Locke, and that'll be at 6:30 p.m. And please register for that town hall if you'd like to attend it on the OI elections webpage as you did for this event. Now I'd like to introduce Representative Jessica Bateman. Representative Bateman has consented to being addressed by her first name during our town hall. Jessica has been our LD22 House representative for the past 4 years, and prior to that served on the Olympia City Council for 5 years, 2 of which were as deputy mayor. Jessica was endorsed by vote of the OI membership for her position in the State House of Representatives in 2020 and in 2022. So before we get to some of the questions that have been submitted, I'd like to ask Jessica to take a few minutes to tell us about herself and her campaign. This is not Jessica's first time with us in a town hall. She reminded me she did a town hall event with us back in 2020. Jessica?
Thank you so much for the opportunity to be here tonight to talk with you again. You're one of my favorite organizations to meet with and ask questions and hear your questions and have a dialogue. So I really appreciate your advocacy and the time that you spend interviewing candidates and all the work in our community. I'd also like to start off by acknowledging the reason why I'm here and running for this position right now, which is that our Senator Sam Hunt, has decided to retire after 24 years of service in our state legislature. We all owe him a debt of gratitude. I strongly believe in honoring those that have come before us and who've served. We serve after them, and so much of the work builds upon the work that folks have done before I've even gotten here. But Senator Hunt has done a tremendous amount for voter registration, democracy, education. I just want to hold him up for that. And so it's a little surreal to me to be running for this seat because I started out as a legislative assistant years ago to Representative Chris Rakedahl. And when he eventually convinced me to run for city council, Senator Hunt was the second person who endorsed me after Representative Rakedahl. So I'm honored to be following in his footsteps. They are big shoes to fill. I'm not new to politics. I did serve on the Olympia City Council for 5 years. I served on the Olympia Planning Commission for 2.5 years prior to that. I was appointed by the City Council. And I also got my master's degree in public administration and did a lot of work on public engagement during comprehensive planning processes. And growing up, I was raised by a single mom who worked in government. So I've always had a close connection to government, and knowing that in the role that she had, she worked to make sure that companies that were polluting were following the law and that they were not emitting too many pollutants. So I always grew up with the recognition that our government is of the people and by the people and works for us. So I'm very passionate about that. My service on the Olympia City Council focused a lot on creating housing and creating solutions for getting our unhoused neighbors into housing. I did lead the Home Fund campaign, and then I worked extensively on creating middle housing changes, and then also the Sanctuary City resolution, which we were all really proud to pass. And since serving in the legislature, I've made my priorities increasing affordable housing, protecting reproductive rights in Washington, and also increasing behavioral health workforce. I'm happy to talk more about all of those things, but there is a lot more work to do, and we have changes that are coming in the Senate and in the House, and also with the initiatives on the ballot, there's a lot on the line and a lot of decisions for us to make in preparation for 2025.
Thank you. The first question I'm going to pose is basically what your role is, and what will change in your role if you become the LD22 state senator as compared to the role you've had as LD22 state representative. How will this be different?
Well, my role as a state legislator is advocating on your behalf, listening to you and hearing ideas that you have about new policy ideas or identifying problems that, things that are happening in our community that you're aware of that I might not be aware of, and coming up with a way to solve those problems. Advocating for increased investment in our communities. I sit on the Capital Budget Committee, so I'm really proud of us being able to get those dollars for our local projects as well as in our budget. Coming up with legislation, consulting constituents, educating. When I hope to serve in the Senate, I think one major difference is that in the Senate, we only have one senator. On the House side, we have two. We have two representatives. And so I think of my role now hoping to get to the Senate is that I'm reaching out to organizations, big and small, and topic areas that I'm not necessarily as much of an expert in. So making sure that I'm covering all my bases, growing and stretching to make sure that I'm talking with folks that I don't ordinarily talk to, so that when I serve in the Senate, I can make sure that I have ample room and I'm aware of all of the issues that are going on, and I'm able to advocate to the best of my ability, even for issues that haven't been committees that I've served on or topics that I've necessarily had a lot of deep work in.
Thank you. Next area I'd like to step into is area of healthcare. And we've had a couple of questions submitted by some of our members, Madeline Bishop and John Suzanne. First question in this area has to do with the question of how has your career in healthcare informed your efforts as a legislator?
Oh, goodness. Well, that's why I was in Seattle today for my day job and working in healthcare. In my day job, I'm a strategic advisor for Washington's 27 community health centers. They're unique in that they are structured as nonprofit health centers. They get a federal reimbursement rate, which is higher than private practice medical providers. So they end up serving a large percentage of our Medicaid population. They also have a whole system of care approach. So they've got behavioral health, primary care, dental, and pharmacy all under one umbrella. And they try to reduce barriers as much as possible by making sure they have navigators on site, WIC, women and infant children, all the different resources that people can get so they can get that all in one location. I think the main influence that it's had on me in my role as a legislator is that so much of the health of a person is impacted outside of the clinic setting. It's said that about 25% of your health is actually in clinic, but the other 75% is the neighborhood you live in, your socioeconomic status. Do you have access to fresh food and healthy food? Are you breathing clean air? Do you have a healthy environment that you're in? And those are all things that policies that we work on in other areas impact the health outcomes of people in our communities. And for the state and our budget, Medicaid is a large portion of that. So it's really in our best interest to treat people holistically and treat the whole person. So I think that's something that I take with me on the healthcare committee. I'm the vice chair. I've been vice chair for 4 years. We do a lot of clinical legislation, scope of practice, reimbursement rates, but I'm always thinking about how does this impact and relate to social determinants of health and whole person care. So that's, and also working with providers and doctors, hearing from them about the real myriad barriers that we put in place and complicating factors, billing requirements. Like with health centers, they have a sliding scale. They will not deny anyone regardless of their ability to pay. And if they don't have Medicaid and they have to pay out of pocket, they have a sliding scale. And it's this incredibly challenging algorithm to try to figure out how much a person has to pay. And I'm like, that's absolutely unrelated to the medical care that they're receiving. The doctor should not be having to negotiate with a patient what their bill should be. So that's also drives my passion for universal healthcare and making sure that we all have access to healthcare and making sure that that's actually something that comes to fruition.
Thank you. And that leads us right into the next question, which was, in 2021, you voted for SB 5399 to create a Washington Universal Health Care Commission. What steps will you take to help Washington establish a universal system of health care for all residents, and how might we be of help to that?
Yes, well, I was very proud to vote in support of that bill. And the author of Obamacare actually said that our bill and that plan was the best he had seen in the United States. So I'm hopeful that it is the beginning of our process in getting to universal health care. We need to follow the steps that they give us. They're supposed to be giving us concrete actions that we can take as a legislative body to ensure that we are prepping ourselves for our ability to have universal health care in Washington. We do need to get federal authority in order to do that. So there are federal changes that need to happen. We have to advocate with our Congress member, Congresswoman Strickland, to ensure that she understands the issue. She knows how important it is. Also with our senators, Senator Murray, Senator Cantwell, and making sure that they have that top of mind as they're moving forward. As you know, Congress is a pretty challenging place. Even if you have a bill that is widely and broadly supported by both Republicans and Democrats, it can be challenging to push it through. So we're going to have to work on our advocacy to make sure that there's pressure both within the legislature to follow the recommendations of that plan, to not let it sit on the shelf and not let it be something that we kind of forget about, but that we continue to take those steps. Your advocacy will be incredibly important. There's a couple organizations that have been working on that and elevating that during session, doing questionnaires for candidates, et cetera. So involvement there, on the 22nd, we're pretty positive on our support for universal health care, but you can always continue to do that and elevate that. And because of your proximity to the legislature, having you testify in committee is really helpful too.
Thank you. At this time, I'd ask what seems to be the impediments to that implementation of the universal health care. Is it mainly resistance from the healthcare community, insurance company issues, health system and investors such as private equity? Who seems to be putting stumbling blocks in front of you? Or is it factors such as consumer reluctance or funding?
I mean, I think it's a little bit of all of the above. It's completely restructuring our healthcare system, which is a huge portion of our economy and impacts everybody that has healthcare. That's a major structural change. There's a lot of administrative and structural policy positions and regulatory frameworks that will have to change in order for us to be set up for that to happen. I mean, I think I have heard that some union members and some unions talk about the potential cost to their union members and their healthcare, and that potentially tripling if we go that route. But I think that that's the job of that commission and also the Office of the Insurance Commissioner, to work with us in tandem to be looking at, as we work forward toward that goal, how do we ensure that costs stay low? you would think that we would be able to have costs actually be spread out better, but that's something that could happen, and we have to work through that. The other thing is federally, we have to get that federal authority. That has to happen. So that's an impediment just because of how difficult it is to get legislation passed at the federal level. The composition of Congress, like right now, we're anticipating this election cycle, the Senate's going to lose Democratic control and it's going to flip to Republicans. So every time that happens, you have to start from scratch. I mean, so much at the federal level is really, really unpredictable. So I think that would, to me, the amount of time that it's going to take to implement is the barrier, and then having that federal authority.
Thank you. I'm going to switch gears a little bit and get back into one of those aspects, which is the funding of that, but funding in general. And this is a question that one of the members posed. Progressives are all in support of increasing resources for public education and to provide adequate health care for all. In your questionnaire, you cited the need to increase Medicaid reimbursement rates to encourage provider participation and improve patient access. What's the best way to raise the funds for increased support for our public schools, transportation, and for healthcare services?
I love the revenue question, because this to me just reflects the values that we have in the 22nd legislative district, that we support progressive revenue, and we understand that it's essential to have, a functioning community and state, that we have to have a robust safety net, and we need to have ample services for people, including K through 12 education. And I know, especially right now with the K through 12 funding issues that are happening, there's a real spotlight on the sustainability of the funding that we've created in response to the McCleary decision. And I think there's a lot of room for us to be improving. And what that's doing is it's making lawmakers think about, how do we make adjustments and change, and think about the equity and the outcomes for different schools. Some schools and school districts have an easier time passing levies than others. And that's inequitable because you see different outcomes for the students in those communities, which was not supportive of our democratic values. In terms of revenue, we're having discussions now, not just in terms of progressive revenue. We are the second to the last in the nation now for how regressive our tax code is. We are not the last anymore because we passed the capital gains excise tax. Thank you. But even with that, I would say that we have a lot more opportunities for revenue, and we're looking at potentially having a revenue shortfall next year as we enter into the legislature. We don't know what the outcome of the 3 initiatives are going to be. If the capital gains excise tax is revoked, that will be a huge blow to our budget. If the cap and invest system is overturned, that's also going to be a huge blow in our budget. So we're looking at, what do we need to do going into next year to prepare ourselves to be thinking about revenue options. Some of the top things that I think that we'll be thinking about are a wealth tax. So the highest income earners in Washington state paying a tax. Also, there's an employee payroll tax like they have in Seattle. So employers that have a certain number of employees and above paying essentially a payroll tax that will go into the general fund. Those are the 2 that I think of that are have the most potential and the most revenue options. We also saw a bill this year in 2024, the real estate excise tax, some adjustments to that to make it more progressive, taxing higher valued properties, multi-million-dollar properties at a higher rate, and then essentially giving a tax break to middle level properties, everywhere from like 0 to I think it was 500 to 700,000. And those, in our community right now, the median home price is about 550,000. So most people would be getting a tax break on that one. I supported that bill. I think it's more progressive and it could generate more revenue than the current system does, even with giving the tax break to those median level homes. So those are some of the things I'm thinking about. I would say that our chances next year of passing additional progressive revenue are better in the Senate we could potentially pick up to 5 seats on the high end. And that would really change the dynamic for us in terms of what we can pass in the Senate. In the House side, historically, the House has been more supportive of progressive policy. It's really been the Senate that's kind of been the bigger challenge. So keeping the members in the House where they are in terms of our majority, having a Democratic governor, and then having that Senate grow would be really helpful for us.
The one topic within the healthcare funding arena has to do with if you might have any plans to craft legislation to find ways to improve reimbursement rates for primary care providers to help consumers achieve access. You had mentioned reimbursement rate a little bit earlier. Just wondering about that.
Yeah, thank you for bringing up reimbursement rates, writ large and generally. What I would say is we've focused, I've advocated for increasing reimbursement rates on a wide range of healthcare providers since I've gotten to the legislature. I've also advocated for increased reimbursement rates for our long-term care providers, because when they aren't getting a wage that's a livable wage, those employers have a hard time recruiting and retaining workers. And these are the employees that are caring for our elders in our community. And there's a real challenge there. I would say that across the board in the healthcare sector, you're seeing challenges with recruitment and retainment and wages. So there are a number of different healthcare provider categories that I would think would be included in a list of providers for reimbursement rates increases. Primary care was just brought up today at my day job as needing to have a better reimbursement rate for primary care providers. And I know that's something we've been thinking about. So happy to put that on my list of things to work on in preparation for next year.
I appreciate that. We, being a retired primary care provider, I can tell you that was a topic of discussion for the 40 years I was in practice. So
Mm-hmm.
I'm going to switch topics totally and go over to another area of expertise for you, which is environment and climate issues. I know you have I think it's a BA from Evergreen in Environmental Studies.
I do, yeah.
And in your questionnaire, you refer to enacting zoning reform to create environmentally sustainable land use, minimize sprawl, and provide a healthy living environment. What would that zoning reform look like, and what areas would it involve? Urban, rural, both? Just what does the zoning reform look like?
Yeah, so the connection between climate and land use is really explicit. Half of the greenhouse gas emissions that we have, the carbon emissions in Washington, are from our transportation sector. And a large part of that is people commuting and people getting around themselves. And so when we think about how we're going to reduce our greenhouse gas emissions and achieve our climate goals, it's really essential for us to be thinking about how we'll change how people get around. A lot of people talk about electric cars. Electric cars are great. I have an electric car. We won't have an entire electric car fleet. I've seen estimates until about 2050. Sorry. So that's not going to be the solution to our vehicle miles traveled problem. What we really have to do is change the way that cities are created and how they're how we construct around them and in them. We have to focus on things like infill development, utilizing property that's already within cities that's vacant, or retrofitting buildings, or rehabbing buildings. We have to make cities more livable and walkable, and that means we have to do that in cities, not in our rural communities, I would say. And these are cities that are already constructed and built, so it's really infill and thinking about how we can make the most efficient use of that land and that space. The reality is we have the Growth Management Act and we cannot continue to sprawl. because we want to preserve our green spaces, habitat, forest, agricultural land. So we have to utilize cities. It's the most efficient also for climate, because when you build housing and places for people to recreate in cities, that's the most energy efficient infrastructure wise, because the infrastructure is already there. Also, we know that young people want to live in cities. They want to live within a 15-minute walk of amenities, things like going to the theater, being able to go to the grocery store, getting on the bus to go to work. The utilization of multimodal transportation and mass transit is predicated on density. And so for people to utilize those alternative modes to get around, you have to have dense housing and people living in those areas. The state's invested a lot in our transportation infrastructure and high transit centers, and especially up in the north and near Seattle. So one thing that we've focused on the last 2 years is transit-oriented development, which is higher density housing near transit and transit centers. And that is like, think apartment complex level height, 7 stories-ish. And so, you know, a lot of cities make it illegal to build that high near those transit centers. We're investing a lot of money in those transit centers. We want people to use that alternative mode of transportation. But in order to do that, because utilization is predicated on density, we have to get people living near there. That requires land use changes. Other things like allowing for grocery stores in neighborhoods, like we have up in the neighborhood center by Spuds up there on top by Capitol neighborhood. It's a lovely little market, you know, we have next to a sandwich shop and a pizza shop. We want people to be able to walk to places like this, cafes and neighborhoods. That requires a bill. We voted and supported that last year, and it died in the Senate. It was a bill that will make it legal to have cafes and also serve beer in neighborhood centers. I think that's a great idea. It's going to reduce people drinking and driving. They can walk to a little place, get a beverage, whether that be coffee or a beer. And I think it's great. That bill died in the Senate, but we have to pass a law in order to make sure that cities are allowing these types of uses. And it's difficult because we're talking about cities that are already built. So it's kind of like having to kind of go backwards and like change, because a lot of these things were allowed before. Like we passed a law legalizing duplexes and fourplexes, and many years ago in the early 1900s, those were already legal to build. So in some ways, we're kind of trying to go backwards, but there's no way that we are able to address our climate and carbon emission reduction goals if we are not also changing our land use patterns. And that's really allowing housing in places in our cities, making sure that we have livable, walkable communities.
Is there an interaction with the zoning reform and the homelessness crisis? Will this have impact in that regard?
There is, because, you know, my interest in zoning reform really started when I ran for city council in 2015 the first time. And that's when I started hearing about the issue of homelessness. When I would talk with voters at the door and be doorbelling, I didn't know anything about homelessness. I was a legislative assistant. I was on the planning commission, and I started talking to the providers in our community that work directly with our unhoused neighbors, our coordinated entry system, our nonprofits. And what I learned was we needed capital dollars for the construction of permanent supportive housing for chronically unhoused people. And I focused on managing a campaign, the Home Fund, which we passed after 2 years, to create municipally funded permanent supportive housing. But in that work, I started researching, well, why are we experiencing this problem in the first place? Why are we experiencing a higher level of our unhoused neighbors? And in doing that research, you definitely find a correlation between high housing prices and high homelessness. That's really where you see the link. So high opportunity areas, economic development opportunities, high housing costs, and then you see that concurrent high homelessness. And when you look at the time, you know, the majority of cities, there are 260 cities in Washington state, and we're experiencing a housing crisis. We're experiencing high levels of our unhoused neighbors, and we're also simultaneously allowing cities to make it illegal to build diverse housing options like accessory dwelling units, middle housing, row houses, permanent supportive housing even, and shared living spaces, which are single room occupancies. the vast majority of cities have made it illegal to construct all of those types of housing. So in the last 4 years, we have systematically gone through and passed legislation making it legal to build all of those types of housing with certain constraints. But it is really necessary because you have to think about housing like an ecosystem. So making sure that we're building enough housing to keep up and keep pace with population growth will help stabilize housing costs in rent and in home prices. And when we do that and we help stabilize those prices in the long term, you're going to reduce people falling into homelessness, because what we see is the correlation between, for every $100 increase in rent, there's a correlating increase in homelessness. I think it's 9% in the rate in that area. So we know that constricting housing supply and not building enough housing relates to people falling into homelessness because it increases the cost. The people that are most impacted are the people at the lowest end of the economic income spectrum, and people that have additional challenges, behavioral health challenges, or needing assistance, et cetera, or people that aren't a fixed income. So it's related, not directly, but it's, when you think about the whole system and thinking about it holistically, I would also say that homelessness is a very big topic. There are a lot of people, when you look at the population of unhoused neighbors, the majority of them are people that we would not associate with being unhoused. They go to work, they, look like you or I. They fell behind on their mortgage or their rent because of an unexpected expense, like a car payment or a car wreck or a health expense. Getting them back into housing is a shorter term investment. It doesn't take much once they can get in, but housing prices are so expensive, that's difficult. And then you have a smaller percentage of that population that are chronically homeless, and it takes different mechanisms to help get them into housing and stabilize them.
Thank you. That was a great answer. Thank you. There's a issue that's been on the minds of a number of folks in our membership, and that has to do with protection of farmland. And this is obviously involved with some zoning, that zoning issue and that. So do you have a plan, or do you, how would you address the protection of farmland? Is that a priority?
Yes, and I guess my question is there a specific policy? It sounded like you were alluding to a specific policy when you talked about farmland.
And it wasn't a specific policy, just protecting farmland in general, I guess, from the sprawl and, losing it to development.
Yeah, I mean, a number of things come to mind when I think about that issue. Obviously, we have a Growth Management Act that says, we need to restrict housing and population growth to cities. And that's where we want the development to be happening. And so we have requirements for cities and counties that they should be adhering to. So we have a system in place to not have an exponential growth in sprawl. That being said, we are seeing the conversion of farmland into other uses. I think the first thing is build the housing in cities, make sure that we are making it legal to do that first and foremost. We have to hold cities accountable. There are cities that are obstructing that process and saying they're not going to follow the law and legalize these housing types and options. It's not just enough to make it legal. It's also, how do we incentivize it? A lot of these home types are homes that haven't been built by developers for a long time because they've been illegal. So we have to be looking at, how do we actually get it developed and make it feasible to build, because we want the housing to happen in cities. The other thing is, I think, cities should be able to build apartments anywhere, especially in cities like Seattle, the largest city in the state. When places like Seattle don't build enough housing, that pushes people further and further out. And inevitably, we're starting to see our rural communities starting to also see population increases, rent prices go up, housing prices go up, because people are just getting pushed out from city to city to city, and they're going further out. The other thing is, we have aging farmers we don't have that next line of farmers that are coming in. So programs that can help incentivize that, help provide funding for folks that want to get into farming. Also, if we are able to stabilize housing costs, one of the reasons why they turn it and convert it into housing is because they can make a profit. It's a good investment. And one of the reasons is because housing is so scarce. So by actually building enough housing, building it in the right places, you're going to disincentivize that by making it less profit in that area. And then lastly, I would say we need to be investing as a state dollars in purchasing those farms. And if a farmer does want to sell it, us purchasing it so we can keep it in perpetuity as farmland or green space and habitat.
Thank you. I'm going to switch gears again and just mention that in your questionnaire that you provided, you stated that your top priorities for the 2025 legislative session have to do with housing, access to healthcare, and protecting reproductive health rights, as you've already stated here. If you had to describe the agenda priorities for the legislature as a whole for 2025, what do you think the legislature's priorities would be? Are there any things that have been hanging over from 2024 or burning issues that are going to be addressed?
Well, I've talked a lot about housing, so that will be a priority, but I'll skip talking about that because I don't want to just drone on and on about it. In addition to housing, which I think will be a focus, and there are bills that we didn't pass last year that I think will be on the menu for next year. First and foremost, it's the budget and making sure that we have a budget that's sustainable, that can fund the programs that we've invested in. We had a decrease. The ARPA dollars that we got from the federal government have gone away. We increased our maintenance level by investing in new programs. We've got these 3 initiatives, 2 of which could just blow a hole in our budget. And then in addition to that, we have to be looking at how do we have a sustainable, aside from the initiatives, sustainable revenue. So I think that's going to be a large focus in 2025. The behavioral health workforce and continuing to make investments in expanding, recruiting, retaining behavioral health workforce. I've worked on that for the last 2 years. I just met with our behavioral health administrative organization and got a list from them of some really concrete steps to help them do their work, which is really important. K through 12 education funding, I think, is something that we're going to be talking about. There's just so much turmoil that's happening with the way that we fund schools is through enrollment, and we've seen a decline in enrollment, and that's really difficult for our schools because they fund up and they have all these programs and teachers and staffing, and then when the enrollment goes down, their investment from the state goes down. And we're seeing, in our community in Olympia, there were 2 schools that were potentially going to close. In Seattle, there's over 20, I think, that they've talked about closing. So it's really concerning, and it's also, I think, highlighting and daylighting this issue of funding. That is a tough nut to crack. It's going to be a huge, I'm not saying we're going to have a solution walking in the door in 2025, but I think that people are starting to realize that we're going to have to address this, and it's coming to light. So I think those are a handful of things that are going to really be a focus in 2025.
Touching on that is a question that was brought up by Madeline Bishop. And that question is, will you reject any attempt to support private schools with public funding, for example, school vouchers or charter schools?
An expansion of them, yes, absolutely.
Another question from a member from John Suzanne has to do with firearms. And the question is, what would be the single most important legislation that should be passed to reduce gun violence in the society?
We've done quite a bit in the last couple years. We have banned high capacity assault weapons, which I never thought I would see happen. We've said that you can't have open carry at public demonstrations, also open carry on the Capitol campus, in city council chambers, and a number of other public places. We've also put prohibitions on ghost guns. I think additional background checks. I also think one thing that I've seen that I think is innovative is requiring people who get weapons to have insurance on them. We've seen that in California. So recognizing there's an increased likelihood and chance of someone being harmed by owning a firearm, I think that it's very reasonable to require that you have insurance in the case that that does happen. And I think that that would hopefully be a disincentive. Um, I'm meeting with the Washington Alliance for Gun Responsibility. I've just been endorsed by them for this campaign, and I can happily say that I've had a 100% voting record with them, and I've co-sponsored every single piece of gun responsibility legislation that has come before us since I started serving in 2021. And I'm more than enthusiastic about continuing the good work that we've done to continue reducing gun violence and suicides in Washington, which are directly correlated to having a firearm.
Thank you very much. The Again, switching gears a bit, and in fact, this next question is from John Gear, one of the members. Will you support legislation to give cities, counties, and special election districts, such as school boards, fire boards, ports, etc., the option of using ranked choice voting, and also the option of moving to multi-candidate races with ranked voting to replace polarizing winner-take-all elections with elections that produce proportional representation?
Yes. And I've been supported by the ranked choice voting organization in Washington. I've forgotten their name, but I think they've supported me in my legislative races and in my city council races. Because I do want to say that so I supported all those topics and those bills. One of the reasons why I do support them is because I agree with John that it's a way for us to encourage more engagement, more participation in our election system. I feel like there's a certain level of apathy within our communities about elections and voting, and the feeling that there's this choice between the lesser of two evils. I have concerns about our democracy right now and making sure that we want to continue getting people involved and increase voter participation and involvement. And so if we can help people feel like they have better choices, that it's not a zero-sum game, and encourage more civility within campaigns, because it's not a zero-sum game, and you're more encouraged to work well with each other with those ranked choice, because you could be second and not, you don't want to get in fights about it, because if you could be second, that would be great. I would flag, though, that our beloved Thurston County Auditor, Mary Hall, has cited some concerns about especially the administration of an every other year election. So changing those city council races to even numbered years to help increase turnout. I would want to make sure that we're going to track it and track the outcome for our local elections workers, because her concern is that in smaller communities that have less funding and less revenue, what they will do is that they'll lay off those election workers in the years, because they won't have them every year. So there'll be lulls where they won't be needed. And if that happens, we could lose seasoned election workers. And right now, as you all know, with our election systems and processes, that's the last thing that we want. So I do think that should those pass, which I've supported, we do need to track that, and we need to provide countermeasures to make sure that that doesn't happen.
Another question posed, Lisa Ornstein posed this, which has to do with your position on ballot initiatives. And I think you've already stated your position on the capital gains initiative, which you favor. And could you mention your position? I think your questionnaire answered that also, but if you could state for the other.
I'm opposed to all of them. I co-sponsored the capital gains excise tax and voted in support of it, and believe that it's essential for us to help make our tax code less regressive. As I said before, we were the most regressive tax code in the nation, and now we're second to last because we passed capital gains tax, excise tax. So one small step, but I do really think it's important that we have that. I also really hate the precedent of having a multimillionaire or conservative, challenging the good work of the legislative body that's been duly elected by the residents of Washington state and our policy-making decisions, and spending millions of dollars getting signatures to revoke that. Capital gains, the Cap and Invest, the Climate Commitment Act, that's something I also co-sponsored and voted for. Both of these pieces of legislation have taken, I think, about a decade. Rep. Dolio worked on that before she went to or ran for Congress. And then when she came back, and it passed the years that she was not in office, but she had worked on that for years, and so had so many others. It's incredibly important that we have a system that requires our biggest polluters in Washington state to pay their fair share and invest in reversing the environmental harm that these policies have created, and also helping to lay a path for us to have a green energy future. There's also a tremendous amount of equity components to the funding for that environmental harm, making sure that the communities that have been most harmed are getting investments. The Long-Term Care Act is something I also voted in support of. It's a landmark piece of legislation, first in the nation, for essentially payroll tax to pay for long-term care. The vast majority of residents in our state are not investing in long-term care. Long-term care insurance has been difficult to get, and also I think people just aren't thinking of it, especially younger people. I'm very concerned with the lack of retirement options for young people. Pensions have, completely disappeared. My mom just retired from King County. She has a very healthy pension, thank God. My dad just retired being a machinist for Boeing, and he also has a pension. My partner will have one, but the vast majority of people, and I will too, but the vast majority of people, young people now, don't have that. So I think the long-term care program is something that we need to protect, and we need to continue to tweak to make it better. We absolutely cannot lose it. And I've signed on to the campaign opposing all of them. And I will be working with you as we hear from the campaigns in terms of getting you materials, making sure that we have what we need to educate voters, because this is all going to be on the ballot this year. And in the election, it's a presidential election year, so Democratic turnout will be high. But we really do have to educate people. I think between you and me, the biggest concern I have is the capital gains excise tax, because we do have a bias that we will all at some point make enough money to have that apply to us. And so I'm really concerned that people will potentially be susceptible to the messaging of that campaign.
It's great. One of our members just reminded me to let you know that we have a ballot initiative team to help work on those issues as well.
Wonderful.
I may have, when I posed one of the questions about the school vouchers, a question came up in the chat that I may have confused folks, or had your answer be confused, because it questioned whether you were rejecting or supporting the expansion of school vouchers and charter schools with public funding. And I thought I heard you say that you did not support that.
Correct. I do not support that. We do
Perfect.
have some charter schools in Washington state already, and those do get some public funding for programs and things, but we can't expand them anymore. So if that was the question, was expansion, and we can't. We have to provide resources for those students that are already being served there, because the law already passed allowing those to be there currently. But in terms of it changing the law to allow more an expansion of public dollars for charter schools, I'm opposed to that.
Great. Well, I think I've cycled through most of the questions, or all of the questions that I had. And I'd like to, as we finish up this session, I'd like to give you the opportunity to wrap up your presentation and your positions, and answer for us how we could best help your campaign.
Thank you so much for keeping me on my toes and making me pivot in the different topic areas for the questions. I appreciate that. I would just end with, we have a lot more work to do. I want to build upon the work that I've done in the legislature so far working to address our housing affordability crisis and making sure that young people, elderly people, people on fixed incomes, low income people, that everyone has an opportunity to thrive and has housing and ample housing. We really have a lot of work to do. We've made significant progress, but I'm ready to take those tangible results that I've already achieved by building a coalition, creating a portfolio of bills for 2025. I'm already starting to do that work while campaigning because I really want to make sure that we're productive going into 2025. Also, reproductive rights. I've sponsored 2 pieces of legislation in the last 4 years in response to overturning the Dobbs decision, or the Dobbs decision overturning Roe v. Wade, eliminating copays for abortion. I sponsored that bill and we passed it. And then also authorizing the Department of Corrections to purchase 3 years worth of mifepristone, one of the 2 abortion drugs, and distribute that to healthcare providers in the event that our federal partners somehow, with different leadership or a Supreme Court ruling, undermine the integrity of that medicine, which is completely safe. We want to make sure in Washington that choice continues to be the rule of law, that we are increasing and enhancing access to reproductive health care, protecting it and protecting providers in Washington, which, I've worked on with a cohort of my colleagues the day after Dobbs happened. We stood on the Capitol steps and we said, we are going to continue to be a state that respects choice in Washington. And we came up with a package of bills and we passed them. And I believe that we'll continue to have to do that work and defend choice, because right now what we're seeing is fetal personhood being used as a way to chip away at reproductive rights. And we cannot let up. We cannot think that we're done. And just because we're a pro-choice state and we have Democratic control does not mean that we can just rest on our laurels. So I'm vigilant on that, and I will continue being a leader on that issue. And lastly, behavioral health. I'm working with our behavioral health partners. I'm talking to them about what we can do to set ourselves up to actually increase access and invest in programs that are working and expand those programs. We're hearing from folks in schools that they need behavioral health specialists. We're hearing from our partners in the community that they need facilities for stabilization. We need more crisis responders with our law enforcement. I'm ready to hit the ground running and work on those issues. I want to be on the healthcare committee and the housing committee and the Ways and Means committee. And I've appreciated your support in the past. I really appreciate all of your mobilization and your showing up, doorbelling, writing cards. I can't tell you how much of a relief it is to have a partner in this work who's helping carry the water as we try to make sure that we're protecting our democracy and also passing really good legislation to make our future brighter in Washington for everybody. So I hope you'll consider supporting me again. I do have 2 opponents in my race, so it's going to be a primary in August. And then the 2 Democrats, the top voting Democrats, will make it all the way to the general. I'm very busy. I'm out there. I'm doing a lot of community work and doorbelling already. And so I'm happy to answer any more questions that you have, or you can reach out to me to volunteer at votejessicabateman.com.
Thank you, Jessica. And one last question floated in, and that is for Lisa, and it asks, how competitive do you think your race will be?
It's hard to tell. I'm not taking anything for granted. I do. One of the opponents in my race was able to, when they ran 2 years ago, they self-financed their campaign and donated almost $30,000 to themselves. So, I'm not underestimating the ability of a person in the race to be able to raise funds like that. And when you raise funds like that, you're able to reach out to voters via mail and, getting out to folks. So I'm focusing on, in addition to all of the community work and attending events, making sure that I'm fundraising so I can get all my literature out to people and let people know what my message is and what's on the line and what I want to work on for 2025.
Representative Bateman, thank you very much. You have been very kind to share your time and your expertise with us.
Thank you, everyone. Have a wonderful evening.
You too. Thank you.